Oh, yes. And Bukola is actually on leave, and I have to be the one to do it with you. And I know you might not really feel comfortable doing this with me, but we would have no choice but to do Radio Doctor together.
Especially for today's topic.
Yes, I got the topic yesterday, and I was like, but I don't have a choice. But we would do it. The whole essence of being here is to ensure that we enlighten the people. And I have no choice but to. I'm always glad to enlighten people.
Okay.
Yes.
Let's see how it goes.
All right. Thank you very much, doctor. And today's conversation is going to be the diagnosis and treatment of dysphoria, right? And that is actually painful intercourse. And you're going to be helping us to shed more light on this, as well as answer questions from our listeners who have questions to ask about their health. So we're going to start off this morning on a very light note for you to give us a detailed explanation of what a dysphoria is.
Okay. Thank you for having me. It's always a delight to be here. And just like you do, I usually like to inform people about their health so that they are well informed to make the right decision. So Perennia is not new. Everybody knows it. So just that the medical term is what is new for people that are non-medical professionals. So Perennia is just painful intercourse. And I see women with painful intercourse, non-medical professionals. So Perennia is just painful intercourse. And I see women with painful intercourse complaints almost on an hourly basis. So if every 10 people, ladies coming to the clinic, 7 would tell you that they are experiencing painful intercourse. So Perennia happens at the moment of deeper sexual penetration. There's no other time to experience this except when the person is actively having intercourse. If I'm not having intercourse, I'm not going to experience it. And you will never know that you are having such condition except you are having intercourse. So Perennia is a sexual dysfunction. When we talk about sexual dysfunction, Perennia is one of it. We have low libido, we have high libido, we have people that are not even want to have sex at all. Perennia is part of the sexual dysfunction. It just means painful intercourse. Research proves that 75% of women will experience painful intercourse at some point of their life. So it doesn't matter when, and it can happen to anyone. People that are very young, people that are old, average, whatever the age is, it has nothing to do with age. Although it occurs mostly in women that are menopausal. But the Perennia can happen at any time in some certain conditions. So the Perennia is the term for recurring pain around the genitals during sexual intercourse. If you have sex, if you have intercourse once,
hello, doctor.
Hello, I'm with you.
I can hear you now.
So but when it's continuous and it keeps happening, then you are now safe to say that you are experiencing Perennia. And for some women, Perennia can be sharp. It can be it can occur before, during, or after sexual intercourse. For most women, usually after sexual intercourse. When they come to the clinic, they are like, I had intercourse and it feels like burning sensation. Some people describe it as like you put pepper. When they put atarodo, how do you call it?
Yes, atarodo.
They put atarodo around that area. The way it feels very pepperish. Some people experience it like that. For some people, it's a sharp pain. For some people, it's no pain. Some it's like meat or a pepperish or menthol that has been applied around the vagina. So the Perennia occurs for women at different times and at different stages of their life. The most important thing is to find out what may be the cause of or the reason why we may be having a painful sexual intercourse. Because it's definitely sexual intercourse. It's time for her to report to the clinic to find out why she is having such experience.
Thank you very much, Doctor. 16 minutes past 10. This is Radio Doctor, your free health consultation radio program where real doctors advise real people. And we are taking a conversation. The topic on Radio Doctor today is diagnosis and treatment of painful intercourse. And the founder of Pink Clinic Nigeria, Linda Keku, is who I'm speaking with, is helping us with this topic this morning. All right, Doctor, before we start taking phone calls, I'd like you to share more light on the symptoms of this, and when you share more light on the symptoms, when should a person know that, okay, it's time to see a doctor about this?
Okay, so that's a very good question. So someone will be asking, how do I know I have Perennia? It's just pain. And like I said, it is pain. And this pain is classified into two, right? Either it's physical or emotional. Some people have physical pain and some people have emotional pain. When I say emotional, it means it's just in their head. And what is causing them to have that pain is an emotional trauma or feeling of being raped or being physically or mentally abused. Those are the emotional pain the women feel. The physical pain are from the physical disorder around the reproductive system.
Okay.
For a woman to know that she has dysphoria, you will experience pain all the time. Anytime of that calls you and say, madam, come, it's time, you're running away because you're anticipating pain.
Okay.
And when you try to do it, afterwards, you experience pain that can last up to 24 hours. For some people, it lasts for 30 minutes, an hour, and then it stops. And for some, it can last for up to a day. So it's mostly pain with burning sensation. Some people experience burning sensation. Some people experience itching. Most times, the dysphoria that comes with itching is a sign of infection. The dysphoria that comes with itching is a sign of infection. So if any woman is having sexual intercourse and she's experiencing pain after intercourse with or without itching, then we need to check for signs of infection. Another thing that can happen is backache. Most times, this usually happens for people that have had intercourse only once or a few times and to grapple their heads around having sexual intercourse, maybe for the new wedded guys that haven't done it before. So at the beginning of their marriage, you may be experiencing aches, especially at the lower back. That's because the vaginal walls are still a little tight and they're trying to gradually open up. So in that case, it's dysphoria, but that's because of the tightening of the vaginal wall. So what the woman will mostly experience is burning pain, itching, or lower back ache. Those are the signs that would indicate that this person has dysphoria.
Okay. All right. Thank you very much, Doctor, for answering those questions. All right. I think there are also questions with regards to which you talked about. Can you actually talk about some of the other causes that can actually lead to?
Oh, wow. There are a lot of them, and definitely I'm going to take them one by one. So I'd like our audience to just sit tight and listen very well. And please, you should feel free to call and ask me any questions.
Yes, we already have some text messages already.
Okay, cool. So the causes of dysphoria is maybe I wasn't well lubricated, because people are very quick to say that, or maybe you were not well lubricated, that's why you're having pain during intercourse. There are other problems. That's the problem. But other causes of dysphoria apart from being well lubricated. So dysphoria can be a physical problem or can be an emotional problem. And the first cause is vaginal dryness. Vaginal dryness can cause a woman to experience painful intercourse. And that's when the woman is not well lubricated or her vagina is dry as a result of aging, because some women get menopause and hormones that could have helped with reproduction are lowered. Are we together?
Yes, we are together.
Okay, so the hormones that help the reproduction are reduced. And the sign of it is vaginal dryness. So when the estrogen levels are reduced, vaginal dryness could occur. And so in that case, a lubricant will help, but you need to be sure of the kind of lubricant you are using. Some people may react with lubricants, some lubricants are allergic to people's skin. So it's always best to use the water-based lubricant so that to avoid the allergies. And then for people that are trying to conceive, you have to be careful of the kind of lubricant you use so that you do not use the one that are spermicidal and pregnancy may not be able to occur. So another cause of dysphoria is childbirth. For a woman that has just given birth, that area is very sore. There is vaginal dryness as well. But some men, permit me to say, are not usually very patient. I mean, they've waited maybe the last third trimester, the woman is not comfortable to have intercourse, and she finally gives birth. And you are telling the man to wait for 6 weeks. The man cannot wait to. So at that stage, when the woman is just returning from the hospital, everywhere is very sore, and if she has even had a scare as a result of the baby, there will be pain during intercourse. So usually, when there's a postpartum mother, usually advise that you can have sex only when you are comfortable to do it. And we try to talk to the partner as well so he understands. Intercourse should be only when the woman is comfortable to do it to avoid pain. Breastfeeding mothers usually experience vaginal dryness as well. So what needs to be done is that a lubricant can be used or just wait for the woman to return back to normal for her to be able to have a healthy sexual activity with the partner. Another reason why a woman will have vaginal dryness, I've said that briefly, is too little sexual arousal. So I want to ask you, Daniel,
yes,
why is it that some men, right, when they want to have intercourse, they're not ready? I usually ask my clients when they complain of vaginal dryness, I usually ask them, have you told your partner how to locate your G spot or a place that can get you aroused? So my question to you is that why is it that men are not usually patient to get their partners aroused? They just want to just do it and they don't really care how you feel.
Well, I don't know if I don't think I have the answers, or I know the answers to that question.
Oh, you don't have the answer.
I don't think I know the answer because it might be an assumption. It might differ from different individuals. I think the younger generations are pretty much quick to listen and have conversations about it than the older generations.
I think I agree with you. The older generations just want to do it. They don't really care whether you get there or not. So at the end of the day, these women come to the clinic complaining, right? So please, partners should just if two people are involved, so they should both be satisfied. So some men are not interested in stimulating their partner. They only just want to do it and get up. But it's always advisable to avoid injuries, because if you go in there and the place is very dry, apart from satisfying yourself, you can also cause injury to your partner. And by the next time you want her to come around, she'll be running away from you because of pain she's experiencing. Infections, like we said, is also one of the major causes of painful intercourse. Infection like the yeast infection. The yeast infection is also known as candidiasis. And candidiasis is a very common fungal infection that every woman once in their lifetime would have experienced. It's not sexually transmitted, but it can just happen as a result of an imbalance of the hormones in the body or an imbalance of the vaginal flora. The vaginal flora are the normal bacteria that protect the vagina, and that's why it's not good for women to use feminine wash around that area. It's always better to just use water. If it's possible, if the woman can do that, because those things that are sold over the counter to wash that area can distort the normal bacteria. And once that is distorted, candidiasis, which is a yeast infection, can occur. And once there's a yeast infection, there will be painful intercourse. Urinary tract infection is another cause of Dysphoria. Urinary tract infection, once it occurs, it affects the bladder and then it can ascend into the urethra. So you don't want to assume that if you're experiencing pain during intercourse, it is normal, because there could be an infection, and if it is not treated, it can cause infertility, can cause kidney problems, and the rest. The fourth one, cause of dysphoria is injury or trauma. If you have a message, we can answer it while I talk about.
Yes, when you're done with the fourth one, I'll start giving out the numbers and reading out some messages.
Okay, thank you. So, injury or trauma from childhood, I've said that briefly. For women that can wait for their wife to recover from childbirth, the woman may experience pain during sexual intercourse, especially if she has a vaginal tear and the wound healing is still in process.
Okay.
So those are the first four causes of dysphoria in women. Men also experience it,
Okay, I was going to ask you.
For the men, yes, but most times for the men, it's usually caused by infection or an anomaly with the penile organ.
Okay. Thank you very much, Dr. Linda Keiko, for making those comments. All right, we have a few text messages, but I want to officially give out the numbers. 07000 917 917 is the number to call if you have any question to ask Linda Keiko this morning, the founder of Pink Clinic in Nigeria. You can call us up in the studio on 07000 917 917. And if you want to send us a text or a WhatsApp message, please do that on 070 317 565 37. Linda Keiko is definitely going to be able to answer your questions this morning. We have a question about a baby. It says, good morning, WFM. I would like to ask the doctor if it's safe to give a baby paracetamol, that the baby is 2 months old, that wouldn't stop crying after immunization injection.
I don't know that message. It sounds like a message from his father, not from the mother, because it's from the mother. When you took your baby for immunization, they would have told you at the clinic to give your baby a pain relief immediately after the immunization. It's very normal. So there's a syrup. The baby has the syrup for the babies that you can give it 1 or 2 drops in their mouth after immunization, because they will definitely, immunization comes with pain. Even for adults, immunization comes with pain. It comes with lethargy and irritability. The baby will keep crying because that's the only way they can express pain. So what you're supposed to do immediately after an immunization, you give the baby few drops of paracetamol or whatever it is that you have for pain relief. Ensure it is prescribed by the baby's doctor. Ensure it is prescribed by the doctor and give it to the baby. Some health centers will even ask you to come to the clinic with the paracetamol. So once the baby is done with the immunization, they give it immediately. So yes, please give the baby paracetamol. Confirm from the nurse or the doctor that you are saying how many drops you can give to the baby. And aside from that, you can also use a wet cloth under running water and apply it at the area where the baby has been immunized, so that the pain is relieved.
All right. There's also another question with regards to a baby. It says, what could be the cause of cough in a 3-month-old baby, and what should I do?
Most times, the cause of cough in 3-month-old baby is exposure. But it was just cold because we couldn't do without the AC. We put him without the AC, he keeps crying. So I had issues trying to balance the temperature the first 3 months. So he was always having cough. So anytime you baby at that age, it's just exposure. So when you're going out, cover his head, dress him up properly. If you can put on make sure that your baby is always on top. Let him or her always be on top. Just try to cover him up properly, ensure that the room temperature is regulated. I'm not saying you should wrap him until he starts to have rashes. No, try to balance it. If you feel cold, the baby will also feel cold. If you're feeling hot, it's the same thing with him because he's also human like you. But ensure that he's well covered and protected from cold. And if he has cough like that, it is not an infection, and it's not cold, it may be an infection. So what you need to do, if the coughing is persistent, please don't administer what your neighbor is telling you to administer. Take your child to the clinic. That's why we are there. Take your child to the clinic so that they can provide medications for your baby to use that will work effectively.
All right. I think we're having a lot of questions with regards to cold this morning because we have another text message here. It's from Theophilus in Oshodi. He says, my question to the doctor is, Doctor, my 4-year-old baby girl has been suffering from pneumonia and have been treating her
Have you been the one treating her yourself, or you've been taking her to the hospital?
Okay, so he says he has been taking her from one hospital to the other, and he's not sure what is going on, and he wants to know what to do because she's still coughing.
Okay. The same thing for the child. The first thing you need to look at is, sometimes, right, when you come to the clinic, because some medical professionals are overwhelmed by work, they ignore the little things that would have caused the problem. And now, if the cause of that problem is not eliminated, if you take the whole antibiotics in Nigeria, your child will still not get better. So look at those little things that would have caused the infection for your baby. If she is always exposed as well, it can contribute to pneumonia.
Okay.
Check the environment. Check the medications you're also taking. And if you've been to a hospital and you're not seeing results, you can change and go for a good one that will give you a good care. It's just that, unfortunately, quality health care is a little bit expensive in our country.
Yeah.
But if that is what you need to do to get your baby back, then do it.
All right.
But please check primarily for cold and all those things that would have contributed to the baby having pneumonia, because that's usually the first cause of it.
All right, thank you very much. 27 minutes to 10. This is Radio Doctor, your free health consultation radio program where real doctors advise real people. And on Radio Doctor today, we're talking about diagnosis and treatment of Dysphoria. And also we have the founder of Pink Clinic Nigeria, in person of Linda Keiko, joining us, helping us with this conversation. You can call the studio line on 07000 917 917 to ask any question of your choice from our doctor this morning. 07000 917 917, and you can send us a text or a WhatsApp message on 070 317 56537. We have another text message here. This is from Joy in K.
Sorry.
Yes.
Daniel, before you read the text message, is he allowed for his 4-year-old having persistent pneumonia? Is he allowed to give a natural health kit that can help?
Okay, yes.
Okay, so what I used to do for my baby is, apart from the medications I would give, I just buy lemon and honey and put it in 2 spoons of water, 2 teaspoons, put it in a cup, put a little bit of lemon, just a little bit of lemon, and a very tiny of honey, like half of the baby spoon, and a spoon of lemon, mix in warm water, and give her just 2 spoons. That's because he's younger. But for a child that is 4 years, you can give her up to 3 spoons. You can do that morning and night for a few days, just for a few days. I'm sure it will relieve her, because lemon is a very powerful natural antibiotic that can also help.
Okay, thank you. All right,
I hope the person that sent that message is listening, so I can get the tips.
All right, we have a call now. Let's take this call. Hello, good morning. All right, just do well to call us back. 07000 917. Okay, cool. Founder, Pink Clinic Nigeria is definitely here to answer your questions. Hello, good morning. Hello, good morning. All right, you can do well to call us back. Or better still, if the lines are not going through for you, do well to send us a text or a WhatsApp message on 070 317 56537. 070 317 56537. Let's see if the lines are going to go through now. Hello, good morning. Hello. All right, 07000 917 917. That's most likely the network. But we have a text message here that says, please, what is the symptom of a deficiency of iron in the blood? This is coming in from Joy in K2.
Okay, Joy. Deficiency of iron in the blood. The symptom is something that you see and you feel, but I'm sure you know, but it's just that you cannot really describe that that's what you're feeling. So deficiency, when your blood level or your iron levels are low, the first thing you start to notice is that you're always getting tired. So you may say, oh, I have malaria. Oh, maybe it's typhoid. Oh, but I've treated malaria. So some of us have a habit of treating malaria ourselves. Every little thing, malaria. Once you have headache, malaria. You have body pain, malaria. We feel like vomiting. Every little thing in this our country is malaria. And we are definitely abusing medications. We're definitely abusing drugs. So the first sign you start to see is that you're always getting tired. So don't always assume it's malaria. If you're not sure, go for a test. The second sign you see is that you're looking pale. You're not even looking as pretty as you used to. Your skin is wrinkled. You're always irritable. You have your mouth feels quiet. Your spit feels very dry. Those are the signs that your iron levels are low. If you're having any of these signs, you don't need to assume it's malaria. Go for a test. You can do a wider blood test. You can do your malaria checkup. You can do a WBC, RBC. All those things will be able to detect that your blood volumes are low. And then the easier way and cheaper way to boost your blood volume is just to eat vegetables. In my village, we call it ugu. Just buy ugu and chop the thing very, very well. And your blood level will come back in 2-3 days. Leave the blood tonic and all those ones. Look, ugu is the ultimate. Buy it and you take oranges. Oranges usually help to absorb iron. So once you take a lot of oranges and you eat a little ugu, you absorb all the ions that you are getting from those vegetables and you bounce back immediately.
Okay. All right. Thank you very much, doctor. I think we have a call coming through. Hello, good morning.
Good morning.
Good morning. What's your name and where are you calling from?
Good morning. My name is Madam TJ. I'm calling from Ibadan.
Good morning, Madam TJ. The doctor is on the line.
Thank you. Doctor, good morning, ma.
Good morning, Madam TJ. How are you doing?
Yeah, I'm fine. Thank you. Please, the question I want to ask is psychological. So I want to know.
Your question again, ma?
No, it's outside the topic of today.
All right, please go ahead with your question.
All right. So I want to know the difference between fibroid and ovarian cyst.
Okay.
Particularly for and that ovarian cyst particularly, what are the signs? And are there cure for it? And thirdly, can it prevent pregnancy?
Okay.
Would that be all your question, Madam TJ?
Yes.
All right. Do well to listen over the radio. The doctor would answer your questions.
It's all right.
Yes. All right, Dr. Linda, you have the floor.
Yes, thank you so much. So fibroid and ovarian cysts are the common condition we see almost on a daily basis because our clinic is a sexual health clinic. So we see everything that concerns the female reproductive system, and fibroid is one of it. Fibroid is a very, very, very common uterine condition that happens to most women. We saw a woman yesterday and she said, I said, okay, your scan shows you have fibroid. She said, how can I have fibroid? I'm not married. Fibroid doesn't have anything to do with you being married or not. It can happen at any age from 16 to your mid-40s and above, right?
Okay.
So the difference between fibroid and ovarian cysts is that fibroid are growths around your uterine walls. Uterine walls is the medical term for womb. Growth around your womb. It can be as tiny as a little ball or as big as a watermelon. It depends on the lifestyle and the things that have nourished the fibroid. We treated fibroid here the other time, so I'm not really going to go into details on that. Then another one is the ovarian cyst. The ovarian cyst occurs around the ovaries. Now, the ovaries is where eggs are released every month. So sometimes when these eggs are produced and are not released, it becomes a cyst. A cyst is a sac filled with water. Infection can cause ovarian cyst, and sometimes it just happens like that. We have what we call the follicular cyst. Follicular cyst is the normal one that happens every month when you're about to release an egg, when you're ovulating. But if that one does not go away, it becomes something else. So, and these cysts are filled with fluid, and most times they are caused by infection, and sometimes it just happens. So, Madam TJ also asked, is there a treatment for ovarian cyst? Yes. The sign of ovarian cyst is pain, usually around your lower abdomen. For fibroid may not really cause so much pain. Fibroid usually cause back pain and maybe pain during intercourse. Ovarian cyst, you have a persistent pain around your side. You may be more during ovulation and you may be less. For variances, the management is usually we just manage it, and usually the cyst is supposed to resolve on its own. But when the pain is consistent, and if the cyst is quite large than 10 cm, then a surgery has to be done. If it's less than 10 cm, we just manage it, and gradually the cyst will resolve on its own. If you're a woman and you're listening to me and you're experiencing this, you don't have to wait for the cyst to reach 10 cm. You don't have to wait for the cyst to be like an orange. Rush to the clinic and get this cyst sorted. Because if you're trying to prevent, it's cheaper than when you're trying to treat. If you're trying to treat, you spend more money. So come to the clinic, have your assessment, check and see all those, because the variances is becoming very, very common and very, very common. And studies have shown that our lifestyle and some of the contraceptive pills that we take contribute to all this. So rush up to the clinic and we can help you manage any of these conditions. I hope Mama T is still listening to us.
Yes. Okay, we have more questions here over on our text line, but the phone line is still very much opened, 07000 917 and 917. It says, please, what disease that can cause the yellowing of urine? Timmy in Ikorodu is asking that question. What disease can cause yellowing of urine?
Yellowing of your urine. Let's start from simple to complex.
Okay.
And the simple things are you not taking enough water. If you are dehydrated, if you took just one bottle a day, one bottle of water a day, and you go to bed at night, by the time you will be very concentrated. And that's because there are different things that make up the urine apart from water. So it will be very concentrated. Another reason why your urine can be very yellow is hepatitis. Hepatitis is a viral infection of the liver, or you can simply say it's an inflammation of the liver. And the sign of it is yellowish urine, or when your stool is very yellow, your hands, your eyes are also looking yellow. So those are the things that can cause yellowish urine. High accumulation of proteins can also make your urine to be very yellow. So if you're experiencing this and you're not sure of which one, you can just go to a clinic near you and run a urine microculture and sensitivity to know if there's an infection in your urine. You'll do a urinalysis to know if there's a protein or something in your urine. If you are dehydrated, then they will ask you, all you do is just take more water. So you may want to do a simple test. From now to like tomorrow, watch it and see how it goes. Take in a lot of water today, up to 3 to 4 bottles of water today. And then by tomorrow, pass your urine in the morning and see if it's going to be yellow like it was before now.
Okay, so there's a question that sort of goes in line with that. And this question is about being pain when the person goes to the toilet only when the person is urinating is when the person feels this pain. It doesn't happen all the times. That's the question. There's no name to the message.
Pain during urination, you should just what you need to do if you are at work, you should just leave your house or your office right now and find your way to the clinic. Pain during urination is a sign of infection, and if you leave it untreated, it will go to your urethra and get to your bladder. So if you're having pain during urination, it is the first sign of infection. What we need to do is to do your urine test to know which bacteria is causing that pain, because definitely it is not normal. It's a sign of infection and you need to get it sorted.
All right. Thank you very much, Doctor. It's 11:15 on Women Radio WTM 91.7. I have Linda K, co-founder, Pink Clinic Nigeria, over the phone this morning, answering every question as much as possible. We're going to take as many as we can take. And we have another call. Hello, good morning. All right. Just do well to call us back. 07917 is the number to call to be part of this conversation. Hello, good morning.
Hello, good morning.
Yes, good morning. Can you speak up? What's your name and where you're calling from?
My name is Perennia from Agege.
Perennia from Agege. You would like to speak with the doctor?
Yes.
The doctor is listening. Go ahead with your question.
Okay, my question is, I've been abused by my uncle before. So that was when I was in training school. But now, I now realize that now I love having sex. And that does not happen before. But the thing starts growing, and now if I start touching my body will start moving. Even if I'm not with anybody, or if I just think of having sex, all my body will start moving. I don't know why.
Okay. Would that be all your question?
Yes.
All right. Do well to listen over. Doctor, do you have any question for her?
No, not really. I don't. You should just listen.
All right. Just listen over the radio, Perennia.
Can she give me a number? Like, can she call a number?
Okay. I'll make sure she does that. All right. Thank you.
Okay, just listen to the end of the program.
Listen to the end of the program, Okpeyemi. I would give out the doctor's number. All right, doctor, you have the floor.
I'm so glad about her boldness to talk about this. It's usually something that people usually bottle up and don't say anything about it. Yes, a problem with early sexual debut or sexual molestation is usually the craving and the love for intercourse, even at all times. So, usually we have advised people like Okoyemi to see a counselor. They are the ones that can talk to you and help you come out of it, and so that things doesn't go wrong. And then if you know that it's becoming it's a problem, then there are other things you should do, especially in terms of preventing STDs and unwanted pregnancy. So please listen to the end of the program. Call me. I'll give you my number. You can call me, and then we'll take it up from there.
All right. Thank you very much, doctor. All right. Let's take another call. Hello. Good morning.
Morning, sir. Morning, sir.
Good morning. Can you turn on the volume of your radio?
Yes, it's done.
All right. What's your name and where you calling from?
Yeah. Good morning, doctor. I'm Alaji Suba.
Good morning.
Okay. Where are you calling us from?
I'm calling from Alimasol here.
All right. Thank you for calling. All right. Your question to the doctor.
Yes. I heard the doctor mention the issue about fibroid.
Okay.
I will even say you should not be disturbed, even if I had this question. Like you said, you have given a kind of a narrative based on fibroid treatment before. But there's a question, which is very, very germane to me, to my mind, which is concerning me.
Okay.
You see, the problem is, my woman have that fibroid, but it has this thing, resurface. But unfortunately, we lost this doctor during the pandemic. It's so painful. So I'm afraid now, and the thing is still, growing. I'm afraid now to even, undergo any surgery because of this woman. I don't want any, issues. So I don't know your advice to that particular issue. The thing is disturbing her, and I don't know the kind of treatment again because, like I said, she has undergone, evacuation more than 2 times.
Okay.
God bless you, ma.
All right, doctor. Do you have any questions for the caller?
How is the wife, sir?
Oh, he had dropped the call. Let's hope he calls back. What was the question you'd like to ask him, doctor?
Yes, I wanted to ask him how old his wife is and if they have children. You see, if you have children, surgery is not, I don't recommend surgery for fibroid. I don't, except the fibroid is now so big that it's 9-month-old pregnant.
Okay.
There are other ways to manage fibroid. If it's the menstrual problem that is like the wahala, which I know that would contribute, that can be managed.
Okay.
If it's the pain, that can also be managed. So ultimately, fibroid is not the ultimate solution because when they are doing this surgery, they will also tell you that if you can go back. That they are doing surgery does not mean that the fibroid cannot come back. It can go back. And there are other ways. If he had listened to me when we talked about fibroid on the radio station, he would have known. Your lifestyle also has a major contribution to the growth of fibroid.
Okay.
Now, if your wife is always feeding on carbs, she needs to stop it. If she's always feeding on red meat, she needs to stop it. If she's always eating food high in fat, she needs to stop it. Those are the things you must do. Engage in exercise. Those are the primary things to do first to help you relieve fibroid. And the population can help you manage your menses very well without issues. Then if you're up to 40, 45, you don't need to worry because by the time you get to menopause, your estrogen that is supporting the growth 45. You don't need to worry because by the time you get to menopause, your estrogen that is supporting the growth of fibroid will reduce. And that means the fibroid shrink on its own. So, sir, please, you are listening to me. Surgery may not be the ultimate. You can come around. Let's even examine is in now, so we can manage before it starts to grow too much.
All right, doctor, I'd like you to start giving out the number from now till the end. We have about 5 more minutes, and I'd like you to start giving out your number that people can actually reach you on.
Okay. Before I give out my number, I will be having a program next week Saturday on the 5th of December.
Okay.
On Tuesday, 1st of December is the World AIDS Day. So we're going to have a program for young 11 years and above, even if you are 30, but from 11 years and above. We're going to be talking about HIV/AIDS, the causes, and how to prevent it, especially for young people.
Okay.
So follow me on our social media page to get more information on that at Pink Clinic NG on Instagram and on Twitter and on Facebook at Pink Clinic NG. You can also call my number 081-8700-7056. That's the number to reach us, and we're also available on WhatsApp, and you can send a text message
081-8700-7056.
And we'll respond to you.
All right. Let me just reiterate that number again. UNG, and the number is 8700-7056. 0818-700-7056 is Linda Keku's number, founder for Pink Clinic NG. So if you have more questions to ask, which we can't take all on the radio this morning, I would advise that you save up that. Final words with regards to the treatment on the issue of painful intercourse that we talked about today.
Okay. Well, unfortunately, we couldn't talk about all the causes. There are so many, but treatment is the first thing is to identify the cause of the problem. Once the cause is identified, then the treatment is always easy. If it's not a physical cause, if there's no infection or there's no trauma, a lubricant can be used. A lubricant can be used to lubricate that area. And another thing is, if that there's no pain during intercourse. And then for people that are trying to get pregnant, be careful the kind of lubricants that you use so that you do pain instead of enhancing fertility.
Doctor, okay.
Yes. And for the last thing for menopausal women, people are getting older. People tend to pain them. It's not normal. It's not good. Right? Old age is something that everybody wants to achieve. So for menopausal women, we usually give a hormone replacement therapy to help you manage all the hot flushes, all the heat and everything. But what you can do is just for you to eat well and then come for the hormone replacement therapy so that we can help you manage your experience during your sexual activity.
All right, Doctor, I'd like to say thank you so much for joining us today, and definitely hope to have you again. Once again, Dr. Linda Keku's number is 0818-700-7056, and there you can reach her out on Instagram and Twitter and Facebook at Pink Clinic NG. Thank you so much, Doctor, for your time.
Thank you, Daniel. Have a good day.
And you too. All right.
Bye.
And it's a wrap this morning. 700-7056 and at Pink Clinic NG on Facebook, Twitter, and Instagram. My name is Daniel Adaja. Till tomorrow, where we'll bring you another Radio Doctor, which is tomorrow's General Health on Radio Doctor. Do well to remain safe. Good morning.
To sponsor this program, please call 90582769.